Hey folks, we're back. Sorry for the little delay there. We're trying to cut the sun off that's coming through, but we're happy the sun is shining in blue.
Right in my face. I mean, beautiful. Right in my face. Absolutely beautiful weather up here this morning, cool and crisp, and we're still 18.
Relax. I have to
we're
introduce
still 18
you.
inches over in rain. Go ahead.
I have to introduce you because every week we have new viewers. And they might not know who you are.
They might not know about the rain report every week.
Yeah, you give a rain report. Hey, folks, Circuit World of Blue Ridge, I want to thank you for joining us for this segment, Ask the Doc. I want to thank North Georgia Cancer Research, always affiliated with Northside Hospital. Dr. William Whaley and Dr. Raymond Tidman, we appreciate it. If you are new to the program, because every week somebody shares this with family and friends out there, we do get new viewers. We have been doing and keeping up with COVID-19, the coronavirus. What we usually do is we take what you hear throughout the week on networks. Dr. Whaley goes through studies all week, and we make sense of it and actually break news of what's really going on. So I will say that. Where do you want to start? Because we have a lot. We're going into Thanksgiving.
we got a ton of stuff.
Okay, we're going into Thanksgiving. There's people out there hearing things about family gatherings. You have a mask.
I do.
In the state of Pennsylvania, the director of health in Pennsylvania is telling them that if they're indoors with somebody that's not a family member in their own home, they should wear a mask. We have Governor of California saying that there's a 10 o'clock curfew, so if you get home at 9:58, you can't get the COVID, but if you get home at 10:02, you could. And I'm not making light of it, but there's so much to unpack here, and I know you know that.
Yeah, well, you know, we got a lot of different things to talk about. The questions that I've been getting all week long are about when can we loosen up. And the vaccine is obviously the thing that's going to tamp down the virus much better than the mask or shutting the school or anything. And so we're going to spend a significant amount of time today talking about the vaccine, which you had mentioned on your opening. I saw a big argument today about if schools are so safe and kids below the age of 12 are so safe, why are some school systems totally open and other school systems are totally closed? I mean,
Can you answer that?
Yeah, I can. It's politics.
It's politics.
It's got nothing to do with the facts. And that I watch these college football games get canceled over a coach and 8 players, and I think how ludicrous that is. And the things that I know that we can discuss and not have to worry about politics are that there is absolutely an increase. Show that first picture there of the hospitalization rate in Georgia, and you look if you look at you don't have it. She's got these are coming from elsewhere. That you got the one on hospitalization rate. So if you look at the tail out hospitalization rate, it goes down and it starts tipping back up again, and every newspaper article has told you how many beds are filled in the hospitals. You can pull that down now, Emily. And I've been around so long. I'm on every large hospital system staff that is in Georgia, and I get these all day, every day. And some of our really top hospitals are going back to conversion of what they were calling mixed wards of persons under investigation with patients, and going back and creating more and more COVID-specific spaces because they need them. So there is no doubt that the hospitalization rate in Georgia is going up. So when we talk about case rates, which are just positive tests, if you look at the Georgia statistics today, we've had 40,000 antigen positive tests, and down here on the bottom, they've started adding the rapid test to it, so that it's a mix of real people that have the virus versus those that might, and they have what they call confirmed cases of 400,000 in Georgia. You see that? And then these people that have the positive short test is 40,000. they got 8,500 confirmed deaths, and now they're adding in what they call probable deaths. Well, those numbers don't mean anything to me. What means something to me is that picture she's got right there is hospital beds in Georgia that have been filled in the last 2 weeks, and everybody has got, the earth is falling. That is less than 1/3 the rate of hospitalizations that are going on in the rest of the country. So they're going up in Georgia, but they're going up 1/3 the rate they are going up anywhere else. Now look at the death rate. That's the next one. If you're going to have hospitalizations, remember they started going up 2 weeks ago. I said your deaths are going to follow them. Ray's exactly right. The deaths that are following them are primarily people that are in our fine china group that are over the age of 70. Most of them are not most of them, but 40% to 1/2 of them are in extended care facilities or some sort of assisted living, so that they're all packed together. But in this past week, I have had 2 employees and or friends who have had cousins that are under the age of 60. One's in the late 40s, 48. One was in the low 50s, 52. Both of them males, both of them with no comorbid conditions, who died of the COVID virus. One after 6, and they were, by the way, in top-notch hospitals in Atlanta. One of them after 6 weeks in the hospital, and one of them after 5 weeks in the hospital. Now, what comorbid conditions did they have? Turns out they weren't diabetic. She didn't know about whether they may or may not have had mild hypertension, but none had had heart disease, none had been smokers, none had had lung disease. But both of them, Ray, what do you think they both had? BMIs above 35. BMIs above 35. 20 is normal. Above 25, they tell you you're a little pudgy.
Above 35, you're really
well, they tell you you're a little pudgy. From 25 to 30, they tell you you're pudgy. 30, I think, is obese, and I believe that 35 or above is called morbidly obese. But anyway, both of them had BMIs in that mid-30s to 35 range. So
I'm going to stay with pudgy.
Okay, stick with the pudgy. But the point I'm trying to make
is the word morbid, and it's not just with COVID. But when you get to be that big, lots of other disease states start haunting.
Right, but as I said, they did not know that they thought they were not diabetic. They had not had heart disease, and were not real sure about the blood pressure. But they knew definitely about the weight. So when you see that and there was a kid, 10-year-old kid somewhere, one out of millions, died a few weeks ago, and I said, look, that's going to happen, but it's one, and it made the newspaper all over the world, for crying out loud, one kid. So one more time, the hospitalization rate's going up. We want to know how we can prevent being in that group that gets hospitalized. And so some people have run out here saying that you should use a mask when you're having intimate relationships. If you look at Sweden now, just came in with a countrywide mask mandate and so forth when they were open for a long time. It is absolutely true that wearing this mask will diminish the transmission of this virus in a crowd of people, and it's got some modest protection against you getting the virus. There is no doubt that if you have had the seasonal flu shot, that if you get the COVID virus, you have a lesser chance of being hospitalized. And if you get hospitalized, you have a lesser chance of going in the intensive care unit. So that the immune stimulation of taking a flu shot helps some. There is no doubt that the data says that if you're taking vitamin D and have a normal vitamin D level, it doesn't prevent you from getting the COVID virus and panacea, but it lowers somewhat your risk. Well, this lowers somewhat your risk. And the social distancing lowers somewhat your risk, and the washing your hands when you come in and out of the supermarket lowers somewhat your risk. None of this is bulletproof. It's not armor. So the armor is going to come when the vaccine arrives. Now, that was where I wanted to spend some time today, was that the vaccine's arrived. Now, when is the vaccine going to hit the place? Fauci said to somebody yesterday it's going to be generally available in the United States in April or May. Our hospitals are already, I think Ray asked, how do you go about, no, it wasn't Ray, it was Dr. Rearick, how do you go about getting on a list if you're a healthcare professional to get the shot? Well, if you're retired and you're doing video visits from home, you're going to be way down the list of priorities to get the shot. But each of our hospital systems are coming up right now with the priority list. Obviously, the people working in the ICU and the emergency rooms and stuff are going to be the top ones. And the people like us who are working in the system and are seeing people outside the hospital, we're going to be down a few levels. And separate from that, in the communities are going to be getting it to the nursing homes first. But I don't think it's going to be April when this thing is available. England is going to start administering the virus to the public, the Pfizer vaccine to the public in the middle of December.
So let me nuance that, Bill, because I feel like people are throwing around a lot of negative or just cold water information. I'll go back to the death curve on this virus. Operation Warp Speed expects to give 20 million vaccinations before the end of the year. And as Bill was saying, that's a lot of people. If that's focused on the high-risk group, the healthcare workers and the nursing home people, that's the group that you really need to tamp down the virus in.
Right.
That's the death group.
Right.
Even though it's only 4% death rate, it's the one that's higher than anyone else. The fact, if they get that many people in the high-risk group vaccinated
by the middle of January,
you've really beat this epidemic.
Because you got to have 2 shots.
Right, but I'm saying everyone else can tail along and get theirs into the late winter and spring. Okay. But you've really hammered where the virus is killing people.
All right, now you got me where we went and ready to go. All right, 2 things. One, big criticism in the last 3 days from Democrats that the virus, I keep saying virus, that the vaccine has been rushed to market too quickly and hasn't been well studied. It'll be really well studied when there's a new president in the White House and they're going to be okay. That's the first one.
And that's baloney.
That's baloney. Now put up that one about what the state's preliminary vaccine plans tell us about distribution, because this is what everybody wants to know. Now, you've got this one. What are the priority populations for vaccination?
That's what you just
said. Okay, now, who are the networks of providers? Who's going to give the shot? Will you go to Ingalls to get it? No. But you've already gotten emails from CVS, Walgreens, and Costco, and some of the huge ones with big distributions, that at some point, not early in the vaccine thing, they will have it to be administered. But that's not going to be in the first few months. And then how's this data and reporting going to be done? And then how are you going to communicate who to where and how to go next? Okay, here's one of the things that has bugged me to death. I want you to show this next one.
Bill, can I interject something that fits
go right ahead.
With what you just said? Our office has already put in an application to be a vaccinator in this county.
Right.
So there are already physicians
you put the
in offices that they're reaching out to who are responding and queuing this up for this high risk.
That's exactly.
Wait a minute, before you go any further, let's clear up for our audience. The noise they're hearing out there is just that noise. Everything is moving forward. Everything is moving forward.
Yes.
It doesn't matter. It doesn't matter what they're hearing at all. Yeah. The vaccine, I think, is it Moderna?
Pfizer.
Moderna.
Okay.
Moderna said 94.9%.
Well, remember now, Pfizer had said greater than 90.
Right.
They're both of them 94%.
But what I'm saying is that vaccine is moving forward. The distribution process is in place.
It's being queued up.
It's been worked on for some time. And therapeutics have been worked on for a long time. So the noise out there, people should not fear. Everything's moving forward.
Correct. And the therapeutics are lowering the death rate in the hospital. Now, so as Ray says, they have reached out to different groups. These huge hospital groups like Northside, Emory System, Piedmont System, Wellstar System, they dominate the whole state. They are huge. they're going to have that stuff available in those. Now, we don't have any of those in North Georgia, do we? So Ray over there has this research group, and he's got all this infrastructure, and there's a form they fill out, and then the system will move along. Somebody's going to put them a freezer out there that takes dry ice, and they're going to get the vaccine at some point. But here, I want to go a little farther, because I'm trying to get the politics out of this darn thing. Show that next one. What does that say right there? Woke research vaccine trials.
Yes.
I got so offended when I hit this thing. The one about the vaccine's been rushed to market drove me nuts. There is now criticism coming from some groups that the vaccine trials are underrepresented in minorities.
Oh, jeez.
Now, Lord have mercy. They had 10 years is the standard, and 4 years was the mumps vaccine, and you're getting this one in 8 months. These vaccine trials require volunteers. People aren't paid. They may get bus fare to get in and get their blood taken, but they don't get paid. So if you don't volunteer for it, you don't get on it. 2, most of the trials are going on outside the United States, where they don't have quite as much cumbersome informed consent forms and everything else. And as I read here a few weeks ago, a lot of these are being done in Central America, South America, and other places where the African American population might be, say, Sweden or England. The African American population might be 2 or 3% and not 19%. So if you look at the 40,000 people in the Pfizer trial and you see that the African Americans in there are 8 or 9 and not 19%, it's not that they've been excluded from the trial. It's just that the population where the trial was going on didn't have that many African Americans, and or they did not volunteer to get into the trial, because people can't be, you don't go out to some place and drag in, 0.86 Pima Indians and so forth to get the balanced number.
The insulting thing is that there's nothing to do with skin color having anything to do with this vaccine.
I understand, right, but that's
what they're implying.
But that's what they're implying.
They're implying
that's
that, well, if your skin's a different color, then the vaccine's going to work differently.
That's right.
And
All right.
That's racist.
Okay, let's go to this next one here, because the question is, when the vaccine becomes available, will people take it? Now, you went back about 6 months ago, and there were 10% of people said, I'll take it. 90% of the people say they don't. This one right here is September. That's a couple of months ago. But if you look at this, these numbers go up and they go down. And then in May, 72% of people said that they would take it. 51% said they'd take it in September. But if you look at the next place they place the data is people who lean toward the Republican side versus people who lean toward the Democratic side. Now, I thought that was absolutely stupid.
You wouldn't think there'd be a political divide in taking a vaccine.
No, but look real carefully. If there's a divide, though, yeah. It ain't a big divide, is it? Yeah, there is a divide. I mean, and I think that I really believe that people that are Republican believe that they take more responsibility for themselves. They're responsible for their own health, and the government's not going to make them all happy. And Democrats think the government's going to make them all happy. But at the end of the day, 2/3 of Republican leaning and 75% of Democrat leaning, that ain't very far apart. And once that vaccine comes out and is out for 2 or 3 months, and we know that it's relatively safe for those 2 or 3 months, I mean, everybody that I know is going to go get the daggum vaccine. So you can pull that down. So I mean, that's the things, that's sort of the noise around the vaccine that I think is harmful and distracting. And the idea that it was rushed to market hastily makes no sense. That the number of people that represented different age groups or racial groups or other ethnic groups was inappropriately arrived at. I think all of that's BS. We should be grateful to the billions of dollars that were given to these companies. The one thing I can say about the Moderna vaccine versus the Pfizer vaccine, and both of them are 95% effective, is it just seems like it's going to be easier to transfer and administer the Moderna vaccine because it doesn't have to be 71 degrees below zero, and it can be kept at room temperature for up to 2 or 3 days after it comes out. So it could go to Ray's office in FedEx with one of those ice things in there, and he could get it have it delivered Mondays, Wednesdays, and Fridays, and take it out of there, and it'd be good for as long as it took. So I think we'll probably see the Moderna vaccine being, there may be another one that comes along after it, but at least right this minute, I can see that it would be easier to distribute a vaccine that doesn't have to be at 71 degrees minus zero.
Well, go ahead.
Well, I want to jump on two things here. The take home that Bill's getting out to people is the vaccination system is solid, here, and about to happen. And people need to be gearing up for it and listening for it, and particularly the high-risk patients, as soon as they hear it might be around, find out where to get it. Number two, I was asked a question yesterday about, is the virus changing in its lethality? I think the question's coming because you see the media just going crazy over case rates. Cases here, worst cases ever.
Part of that was the demonstration a couple of days ago that the virus in the U.S. and the virus in Italy are not the same spike type as the Chinese virus, and that it is substantially more infectious and the viral counts are higher, but the fatality rates seem to be lower. So there was a mutation of that thing. And by the way, you heard it first here 3 months ago.
Right.
So that's confusing. It's more infectious, but less fatal.
No worse lethal.
Yeah, but less lethal probably.
Well, we think probably, but all we can say right now is no worse lethal.
Right, okay. We can certainly say that.
More infectious. It spreads more easily.
Yeah.
But the other big point in this is that this virus, unlike almost any virus that virologists look at, let's just back up here. The Spanish virus that went 100 years ago had a little bit different of a death curve to it. Most viruses have what they call a V-shaped death curve. It really hits the very, very young and really hits the very, very old. Most viruses are in that. And the middle people, not so much. Now, middle people die, but the high risk are in the babies.
The babies and old people.
That's classic virology. The Spanish flu virus had kind of a shifted W to it. It hit the babies, it hit the elderly people, but there was a middle range of people in the 20s and 30s that it also attacked.
A lot of that had to do with World War I and the people being in trenches.
In trenches and in troop ships and being moved around, because all that was happening at that same moment. But needless to say, when you look at the age-adjusted death curves, it had that funny shape to it.
Yeah.
Okay? This virus, there's nothing good about this virus, but if you could say something good about it, it has a bizarre death curve because it's very, very low at the babies.
Flat as a pancake.
Flat as a pancake.
To get into 30s.
And then you get up to 70 plus, and it jumps up, okay? The death rate in children is percentage-wise 0.3 zeros and a 3, okay? That's 3 children in a million could die from this virus. Whereas the death rate in the higher risk group is 4%. Okay, that's 4 in 100.
That's a big number.
That's a big
number. If you had that kind of odds in Las Vegas, you'd be betting on the 4 in 100 one, yeah.
And so you kind of connect those two lines, and you ask the question, well, what about the cases? What about the death rates? What about another spring like we just had? Well, the cases are going crazy. We're going to have this all over again.
Well, this is the spring. Yeah. We've had it again.
Right, we're having it again. But the thing is that you are now sampling a different age group. We are now sampling an age group that's adjusted 10 years younger than we were in the spring.
Yeah, all the college kids and all that.
Kids. So you take that distribution of people and you shift 10 years, you are now picking out people that are in the not going to die group. You understand what I'm saying? Mm-hmm. And so while they're being hysterical
case
about
rates
the
goes
case
up,
rate,
hospitalizations are going up a little.
A little bit.
Death rates are going up a little, but not like the case rate.
Not like they did in the spring.
So not like the case rate.
Let's just be clear. Last February when we started here, and actually when America first started this started coming out February, March. We were at that time building our test kits, having them, creating test kits. At that time, our data was not accurate because we were getting tests that were 4 to 6 days from results. So we were always looking at results a week behind. The developments, we were focusing on our seniors first, first responders.
And people coming in sick.
Right, people coming in sick. So we had it narrowed down. Then we started testing and test. So this year, when you're watching TV and they show a graph and it just goes like this, we have to consider, not this time last year, but we started out not testing 20-year-olds.
Right.
We started out not testing kids to go to school. We started out...
Let me build on what you just said there. We were not testing the healthy group that gets a cold from this.
Exactly.
Okay?
A cold.
We are testing, the median age of the test population that we're pulling in right now all over the country is in the 20s. That's the median age of who's getting tested. We were
a few weeks ago, it was in the 40s.
Yeah. So we were testing a whole different population that was more at risk of hospitalization and dying than we are now. So when the media keeps coming out and saying case rates, yeah, we're testing and finding the virus in a younger population, which gives them the flu and a cold, and 3 in a million deaths.
We're not making light of it here, but when you say a cold, I was with someone last night at a meeting, and this individual, it's been about 2 months ago, this individual, 3 days, tested positive, like a bad cold. I talked to the individual how do you feel now? I feel fine. It's like I had a real bad cold that I couldn't kick for about 3 days and started going away, and next thing you know, I'm okay.
But remember
What you're saying here, and I understand is the group that gets sick but not hospitalized, that is, people are positive, and next thing you know,
he's still in that tiny group that got sick.
Right.
Most of the people with the virus aren't in that group that got sick.
They got that's what I was getting ready to say.
They've been tested.
So here's the way. I'm sorry to keep stepping on you, Bill.
That's right.
But this is the way to look at it. When Bill gets a case in of positive prostate cancer, he talks to the patient about their age and other risk factors, and he gives them information about how aggressive you should or should not be with this cancer, because it has a different effect according to your age.
Some people we don't treat, we watch.
We don't even treat at all, you just watch them, okay? Here with this COVID virus, it's the same kind of knowledge. You would ask your physician, okay, I'm positive, what am I at risk for? What's going to happen? And your physician would be hopefully an informed person and say, yeah, you're 20 years old, go home, isolate yourself, don't be spreading this around, and I'll see you in a week.
If you get a fever, take Tylenol
and
stay well hydrated.
Right.
Gatorade and chicken soup, as Dr. Marlowe says.
If you're 50 and overweight, I'm going to be trying whatever medicines I can get in you now as quickly as possible. But it's a doctor-feathered decision process from an informed position. And everyone's not the same. And so to constantly have the media broadcasting out there that all these case rates are going crazy is not informed. It's not helpful.
All right, now I want to get into the things that have come out of this in the last week that make people sort of shocked. The use of the mask in big box stores that have national prominence has had an exemption for people who had difficulty breathing, chronic lung disease, or allergies to the mask, that if they got a little chit from their doctor, they could go into the big box store and not be masked. I don't know how many of you pay any attention to Costco, since we don't have one up here, but as of Monday, Costco will be requiring the people with those exemptions to wear that face shield that you see, which therefore doesn't
Doesn't protect your air.
Well,
at all.
but it lets all those old people that had exemptions because of allergy to the mask or I can't breathe or whatever, it takes it out of there. But what the face shield does, and it is part of the PPE. As a matter of fact, I sent to Ray yesterday 2 different hospital chains instruction of how to take care of the emergency patient that you don't have long enough to get a negative COVID test on before you have to intubate them, gastroscope them, or perform surgery. And the PPE requires that the surgeon wear a shield. Well, surgeons have been wearing that eye shield since way back at HIV when they were doing hip replacements, and you ground up blood that flew in the air. So that shield protects the person who's wearing it
from spray
and stuff, and doesn't protect. It's not like this to keep germs out of a surgical wound. That's what this thing came for in the first place, keep germs out of the surgical wound. So that face shield there, idea is to protect that person wearing it from the spray people get talking in front of them. But it isn't a real big air filter, and so I think that's probably a little bit. It's sort of just a gesture toward greater protection. I'm not sure that it's going to have any useful. It's not
particularly in the big box store.
It's going to make people nervous, is what I'm thinking.
And I see people wearing them in a big box store, and I'm like, okay, well, if somebody sneezed in your face, you'd have a little protection there. But it's not protecting you at all from the virus if that's what you mean to do. And then, we were talking last week about the learning about your mask and wearing your mask right and what the average people do. I literally had a patient in last week, BMI way over 35, diabetic, with wounds that don't heal because her immune system's so compromised by her weight and her diabetes. She was dutifully wearing a mask that was nasty. I mean, it was so bad, I had her throw it away, and I went and got her 4 masks out of my storage because she couldn't afford them, and she'd been obviously wearing this thing for a month. That's not helping her at all. And this is the person in the highest risk group, and it was just a surgical mask. I mean, she doesn't have the N95. So I'm like, okay, well, this is why when you see these studies, random studies looking at the population of the mask not helping, is because you got a lot of people who don't understand the mask, and they're either wearing a dirty mask or mask too long.
Or they're wearing that little gator thing we've proven
or
doesn't
they're wearing
work.
A shield. They're not protected.
Or they're wearing it under their nose.
Under their nose. So, I think that's why when we harp on mask things and we harp on what we harp on, we are losing our opportunity to talk to people that this virus is still out there. If you're elderly or high risk, you need to learn about it. You need to protect yourself. That's not gone away. So no matter how much Bill and I are talking this morning about the good news, that piece of news has not gone away. So our audience needs to know, are you in that group? Protect yourself. And everyone else needs to lighten up. Now, one other thing I want to go on a bandwagon about.
We don't have any politics there.
No politics.
Okay,
but this is about children.
Okay.
This is about what's happening to these children in schools, because it is beyond offense. Okay, these children do not die from this virus. They will die from poverty, and they will die from disease and malnutrition. And to shut these schools down and deprive these children of a year of education. Now, it's going to net out a year of education.
And social interaction.
And learning how to play in the sandbox.
And losing and not getting on the team and everything else you have to do.
And not getting a meal that's sometimes provided for them. It is literally more, quote, treatment is more deadly than the disease. And to me, it's medieval. I mean, back in the plague days, you'd go in and the friar would say, okay, well, flog yourself till you bleed, or 10 minutes, and then come in and say a bunch of these, and you'll be okay. Okay? People weren't going to die from that, but these kids are going to be stunted and harmed by these politicians who are shutting down these schools.
And that's how I opened up today. If schools are safe, why are some schools totally open and other school systems are totally shut? It's not science.
It's not science. It's political.
It's
and
political.
Money, okay, you can bet the politicians who have the big salaries and the other people who have their kids in private schools, those schools are open. These are the public schools with the kids who are struggling and struggling fatherless families.
And I think some of the problems, the unions of the teachers, because some of these teachers' unions, and I think that's political as well. I saw Cobb County had a big rally yesterday or day before yesterday of the teachers union in Cobb County, and they're holding signs saying, "I can't teach if I'm dead." And I looked at that picture, and that woman wasn't 25 years old that was holding that sign. So it's that part's all politics. I don't have any, I don't have a horse in that race. I've said repeatedly,
we
school ought to be open. School ought to be open. The ball games ought to be going on. And if you got 2 or 3 kids on your team that have got positive for virus, they ought to go home, be replaced by the substitutes. Keep on playing.
I understand. I always try to make sure that I'm taking the virus serious, and when I say that, is because I've had people send me messages, and I have seen hospital care, therapeutics, and the treatment with the vaccine. And I go all the way back personally with my family last March. And I've seen the difference. But,
you realize that you really at the start. Your family died in March.
Right, exactly.
And if it had been now with this antibody and some of that other stuff, they might not have died. Now, there were sick people with
I told both
disease.
of you this, and nothing about it was negative towards physicians or doctors, but actually when my dad went in the hospital, this is in the first 2 or 3 weeks where
they didn't know what to do.
My sister would call me and say, I really think they just don't know what to do. When we talk to them, they don't know what to do. And that's not a negative, and wasn't taking a shot at the physicians. This was new.
Okay, then they did not know about anticoagulation.
Exactly.
They did not know about the autoimmune cytokine storm. They did not know about steroids. So the things that
and the other thing that fits on that fourth finger, Bill, is that they assumed that it was a respiratory virus because it spread through the respiratory system.
Yeah.
Right.
But it's a multi-organ attack.
That's right. They didn't know about
We didn't understand that.
They didn't
We
know
were
about
looking at the
multi-organ failure and that.
I tell you what we have to do before we close, because next week we will not be here. It'll be Thanksgiving week, okay? So we'll be out Thursday, Friday, Saturday, and Sunday. We'll not be here next week. And just that, touch a little bit.
Well, you can show the best of, you can run the best of.
Do we have a best of series?
Yeah, we do.
Oh, okay.
Yeah, we got that one. We got that one from back in March when we really scoped the world. But you could, or you could
make sure you get Leo in there.
Or you could go
Leo,
get a Zika one and put it in.
Get a Zika update. We used to. What happened to that? I do want both of you to touch. We're going into the holidays, traveling. Airplanes, trains, automobiles, favorite movie, sorry, didn't need to get sidetracked.
That was good.
But family gatherings, indoor, outdoor, mass, there's a lot of talk about the holidays, getting together with your family, traveling, things like that. I would like for both of you to give some tips.
Okay, I'm gonna make it really quick
holidays.
because I believe that you should minimize your risk and minimize the social aspects of it. So our Thanksgiving, we have a whole family, as you know, in New York State.
Right.
I would not be against them coming down here on the airplane, coming to our home and having Thanksgiving, but if they did, when the kids go back to Cornell, they'd have to go into isolation for 2 weeks because Georgia's, quote, on the list, end quote. So that's a political reason not to come. Our family who lives in Atlanta that Jane and I see about every other weekend, those kids are well protected. The parents are working at home. They are coming up here. We're going to have Thanksgiving dinner in our apartment. We're going to wear the mask when we're out of doors and with somebody else, and the mask will be off in our house. There are people who tell you that you should be wearing a mask with your family in the house. If you're not wearing a mask with the family in the house now, what difference does it make if you wear it on Thanksgiving Day? And the guy in New York said that you should wear the mask at the table and pull it down when you eat and drink and put it back up. I mean, that's ridiculous. So I think you have to construct it for your own family. If you've got 2 88-year-old people in the house, you're not going to have a whole bunch of teenagers coming up here from Macon or something in the house with them without masks. If the kids came up from Macon, they have not been with them before, those kids should wear a mask when they're in the house, and they should be at 6 feet from the old people. If it's not that way, then get the family together and have Thanksgiving.
But I'd add to that with one other angle. And I don't think we have a study on this. We don't have any way of really being scientific about it, and it's just from years of clinical practice. Humans love their freedom. This is a country about freedom and liberty. And we have now had 9 months of people stomping on our liberty and reducing our ability to do what we want to do. So to echo what Bill's saying there, do what you want to do, okay? Use the advice, take the advice, but don't let anyone take your holiday away from you. These people that are already shutting down Christmas, they're nuts, okay? So be with your family, enjoy the love of that family, and be free.
And find a way to do it safely.
Safely.
Yeah, I agree with that.
That's the whole.
That's what I was trying to
thing
say.
here, is we're trying to give you how to do things safely for the people who need the safety.
But not have to give things up.
Not give things up, and don't let anyone oppress you. Stop this oppression.
Right, I've got a patient who's elderly but fit, and who lives in Blue Ridge, and whose family lives in Florida, and she has made the decision that she's not going to Florida with those young people in the family, and the young people in the family are not going to come up here, and that she's going to have a couple of her I would say old biddy friends, but they play bridge together, all together on Thanksgiving, and they are going to FaceTime their Thanksgiving dinner up here in Blue Ridge with their kids down there in Florida, and one of the other woman's kids are up in South Carolina or somewhere. So literally, they really made, so these 4 women who play bridge together are going to get together and have a Thanksgiving with the video link to the rest of their family. That's clever. It's safe.
Well, let me say, Light Up Blue Ridge has been canceled, so usually next weekend there's maybe 10,000 people here, maybe, but it's been canceled. And this year Santa Claus will be behind plexiglass. Okay, he will.
But at least it'd be Santa Claus and not.
I will say, Sycamore Crossing is lit up already. You go downtown Blue Ridge tonight, and you'll see Sycamore Crossing looking like any other year. They did not let Light Up Blue Ridge diminish Sycamore Crossing's Christmas decoration.
So the other day when I've got the message that Santa Claus would be behind plexiglass this year, down in the center of town, I said, well, there's going to be that kid 25 years from now, and he's going to be laid out, and he's going to be talking to maybe somebody that's helping them through some things. It's saying, what is it? So, well, there was that year Santa Claus was behind plexiglass. And it caused, I went to see him and he was behind, I don't know, maybe I shouldn't be saying this. Thank you so much for North Georgia Cancer Research, affiliated with Northside Hospital. I want to thank you for that. Ask the Doc. I tell you what, I appreciate these 2 doctors. I appreciate what Dr. William Whaley does every week, researching with a lot of his colleagues down in Atlanta. Don't hesitate to send us messages. Tell us if you like the program. Send us your questions. Info, INFO, at FetchYourNews.com. Put in the subject line, Ask the Doc. Send us your messages. Follow us on social media and find Ask the Doc. Send them messages. You can find this on FYNTV. Share with your family and friends. And then also on our Facebook, our YouTube channel, Fetch Your News, FYNTV, the playlist, Ask the Doc. So thank both of you.
Get a flu shot.
Get a flu shot. And the All-Star Political Panel will be up right after these brief messages.